Dr. Harris.
Thank you very much, and thank you, Doctor, for visiting with us today and for visiting with me after your appointment to the NIH Directorship. You know, I know it's, we brag on the fact that we've, raised the budget, but I hope everyone will agree that America's getting sicker, not healthier. Mm-hmm. Whether you look at mental health, physical health, life expectancy, maternal mortality, fact of the matter is whatever we're doing, it's just not working. Mm-hmm. And there's a reason why, Mr. Kennedy and Mr. Musk are going to have a say in this, because I think they realize that we have to make America healthy again, and we have to do it efficiently. So I'm going to ask you a couple of things along those lines. First of all, we talked about indirect costs. Fact of the matter is, in my agriculture subcommittee, we limit indirect costs at 30%, yet at NIH it's functionally limitless, including large endowed universities who actually are subject to the excise tax we impose. I mean, these are large. These are, $500,000 endowment per student. We're still subsidizing their administrations, their overhead. So I would urge you to consider applying the same caps, which would allow, as we have in agriculture, which would allow us to actually fund far more research projects. And, the university's got to get a little bit of skin in the game, more skin in the game than they have. Let me talk about nutrition and prevention, because this is something I have spoken with Mr. Kennedy about. We have the attitude in America that Ozempic, I guess, is going to cure our nutrition problems. Yet we spend, in the SNAP program, for instance, $110 billion program, $10 billion on sugary sodas, and probably $5 to $10 billion on salty snacks. Yet when I had a hearing, and we called over to the NIH to get someone from the Office of Nutrition Research to actually testify on this, we were told that you don't have a scientist at NIH who specializes in studying diet-related diseases. Is that true? I mean, you list Alzheimer's as a major cost, but obesity, hypertension, diabetes, these are the drivers of huge costs to our Medicare program. Do you really not have a scientist at NIH who specializes in studying diet-related disease?
Well, so I'm really glad that you brought up these issues, Dr. Harris, because you couldn't be more wrong. I mean, that perception could not possibly be more wrong. I mean, nutrition is fundamental to health. We all understand that. And I can't think of a single institute or center across NIH that doesn't in some way or form have research that touches on nutrition.
You're missing my question.
Okay.
In the Office of Nutrition Research, we were told you don't have a scientist at NIH who specializes in studying diet-related disease. Is that true, or were we told that because NIH just didn't want to get involved in this argument over the SNAP program? You'll have to get back to me because obviously you don't know the answer. That's what we were told. I got to tell you, Mr. Kennedy will probably change that over at NIH.
I believe that's incorrect, but yes, I will.
Well, then you'll have to explain to my office why we were told that you don't have one. Because given the huge cost of obesity, hypertension, diabetes, cancer, which as a cancer specialist is diet-related, how you do not have that at the NIH, I don't understand, but it might be why, despite a $50 billion budget request, we're actually sicker now than ever. I don't know. The issue of trust of NIH was brought up. Now, you recently received a letter from House Oversight regarding a $9.7 million NIH grant after Dr. Johanna Olson-Kenny, the medical director of the Center for Trans Youth Health and Development at Children's Hospital Los Angeles, told the New York Times that she plans to delay publication of her study, NIH-funded, because the multi-year study found that puberty blocker treatments for adolescents with gender dysphoria did not experience mental health improvements. Did you receive that letter?
I did.
Is it true that she's delaying publication of an NIH-funded study because I guess someone didn't like the outcome of the study?
I know the same thing you know, which is the article from the New York Times, and we have not seen a publication of that study yet.
So as far as you know, it's true what was published in the New York Times. You have no reason to doubt that the New York Times published exactly what a $9.77 million NIH grant recipient is delaying publication for, I will say, political purposes. Well, is the position of the NIH that that's acceptable for an NIH grant recipient?
I would really love to address this issue for you. First and foremost, NIH concentrates on science, not on politics. We actually have a mandate, an integrity mandate against political interference in our work. That, that is the law for us, and we abide by that completely. This particular issue, the particular issue of whether what our grantees publish or not, we absolutely encourage our grantees to publish. It's also probably the leading criteria for them ever to get any funding in the future. If they haven't published on what they did before, they're not going to get funded again. But more important than that, there's 2 safeguards to make sure that the public gets access to data as a result of publicly funded research. And this is not an option for the individuals. They have to submit a progress report every year, and when their research is done, their data becomes the property of the public. It is U.S. government data and has to be shared appropriately with the biomedical research enterprise. So even if an individual, we don't compel them to publish, but even if they don't, we will have those answers to deliver for the American people and for you.
All I can say is the American people spent $9.7 million on that study. That study should be published because, as you know, this is what creates the doubts about the NIH. Yield back.